Welcome to day 2 of our Building Diversity in Digital Health event. We had a very exciting afternoon yesterday. I'm Louise Sinclair. I'm facilitating today. Amongst other roles, I'm the co-founder for One Health Tech, which is a global network that supports underrepresented groups in health tech. And I've worked on this event for quite a while now. It was originally going to be a face-to-face event, but here we are by the magic of Teams all together. So Paul Rice and Aisha Rahim have also worked really hard on this event, and you'll hear from them a little bit later. A final quick thank you to the Ocher and Humber HSN and the Shiri Network for all the support in helping us pull this together. So unless I've missed anything, I'd like to hand over to Paul Rice. Paul's currently the Director of Digital Transformation at NHS England and Improvement in the North Eastern Yorkshire area. Paul's really humble about this, but if it wasn't for him, we wouldn't all be here today doing this event. So I'm really delighted to be here and welcome you all. And over to you, Paul. Thanks.
Thanks very much, Louise. And I'm sure I said overnight to cut that out of the script. I'm not humble at all, as anybody who knows me. Welcome back, colleagues who had the opportunity to join us yesterday. Welcome along, new colleagues. I can promise you a really interesting, stimulating and diverse morning. We had an excellent afternoon yesterday. Just to reflect overnight on some of the headlines from yesterday, I hope you all brought your own chair, because we were all very much the theme of the start of the day was, don't wait to be asked. If you don't feel you're being included in these conversations that are critical and vital, and the conversations are not diverse, then pick up your chair and join that conversation. We talked about microaggressions and the extent to which, from the perspective of a number of colleagues, why is the colour of our skin so determinative in so many ways? We had lots of authentic conversations and reflections on the qualities of people, much more than the why anything was being determined by the colour of their skin. I spent the evening last night thinking about what a Glamazon was. Our colleagues from Amazon talked to us about diversity in the networks in their workplace, and the LGBTQ plus network that Amazon has that's called Glamazon, and that took me to a different place. But we also reflected very strongly on some of the intersectional issues about this agenda and about digital poverty, and an area where I guess when we think about diversity and building diversity and going forward, one of the questions that we were challenged to ask ourselves yesterday was how much of access is determined on economic status and the ability to either afford that internet connection or afford that data bundle. So I'm sure that's a theme we may well return to today. Really stimulating and session from Fatima Khan Shah about the role of carers and how digital is actively supporting carers, but also again, reminding us that we now in the NHS and social care, 25% of our workforce are actively fulfilling responsibilities as carers currently at the same time, and are we thinking about that on a day-to-day basis in terms of how we support those people to be the best they can be in their professional lives. We had a really stimulating conversation about data and why some of the vital data points that we need in terms of addressing this agenda appear to be missing currently in the way in which we construct data sets, and how do we address that going forward, particularly as we're on the edge of the AI generation, and what's feeding those algorithms, and how do we ensure that diverse perspectives and the right data points are being incorporated into those models going forward. We celebrated the contribution that Black and minority ethnic colleagues made over the history of the NHS to date from the kickoff, and had a really delightful presentation where Lewis and his brother Reese, who currently work in digital and data in Ardash, mental health and community provider in South Yorkshire, were able to share with us the story of their mum and their grandmother and their contribution to the NHS. And I guess the last one for me was the conversation that we had with Victor Adebowale, who was talking about the Rooney Rule, and do we need to make positive steps forward in relation to shortlists and ensuring that we have a diverse group of candidates coming forward for appointments. And his maxim was, if you don't have a diverse team, you don't have a competent team. So that was my sort of reprise from yesterday. Say a very stimulating, challenging afternoon, and also from the perspective of of being a participant, just some really genuine conversations, some heartfelt conversations, and a real warmth in the context of how the event ran. Today we have a full programme. I guess again I would just like to underscore the why and the how. Today you'll hear from people who've got very strong perspectives and learned experience about building diversity and digital health, but also giving us some very practical tips about how they've influenced the agenda in their organisations and in their lives to make sure that we all can reframe and work differently going forward. So that would be my reprise from yesterday, Louise, and also my I'm on bated breath in terms of the quality of yesterday, and if we can at least match, if not surpass, that standard.
Absolutely. Thank you, Paul. And yeah, I don't know if anybody caught Victor's talk yesterday, but it was fantastic. And one of the things that we are doing, obviously we're recording today, we recorded yesterday, but we're going to be taking out sound bites as well as the full presentations from everybody, because there was just so much good content, and we want to repurpose that as much as possible. And I know, Paul, you referenced the Rooney Rule, which I thought was so interesting. I did have a bit of a Google of it last night, and essentially it was about the football in America, where they had loads of black players but no black managers. So they enforced this rule where they had to interview, and they had to consider black people for managing, and they did, and it worked, and they transformed, and they were more successful with the black manager. Anyway, Google it. It's really worth a look. It was really, really insightful and just really simple, but really, really nice to hear.